So it's for everyone. Hi, it's Dr. Alissa. So we're going to be talking female reproductive hormones. All right. So here is like the gist of it from my point of view. I want you guys to understand the significance that our hormones play truly in our day-to-day function. How a lot of it is kind of commonly not really addressed 100% from the typical medical approach and evaluation. I'm not poo-pooing it, I'm just saying like, so we're gonna be doing some hardcore physiology, okay? As I put in the presentation, some Cliff Note physiology. So this topic is very important, very, very important for our overall health and well-being, but it's very complicated. So I'm trying to give you, like, as I would say, like the nuggets, because I could seriously get into the details of this and talk to you for hours on end. And this is really speaking more about predominantly, as you'll see, ovarian and adrenal function, some thyroid, but the thyroid itself could be a whole other workshop, okay? So I'm gonna try to tie it all in so at least by tonight you understand what I think should be like the big bullet points, okay, about normal female health. Good deal? Okay. So if you need me to stop on anything, just let me know. But these are really, especially as a provider, we see a lot of challenges among the female population. I think these are pretty much the big ones. So dysmenorrhea, amenorrhea. So dysmenorrhea is like heavy periods, cramping, right? Like, you know, what a lot of women kind of suffer with. Amenorrhea is that you don't get a period at all. Like it's so irregular that you won't have your cycle. Endometriosis, do you guys know what PCOS is? It's polycystic ovarian syndrome. And I'll talk about that when we get into it. Infertility, fibrocystic breast. Now this tends to be some of what we see more on the tail end of our kind of, as you would say, perimenopause part of our cycles and stuff. Fibroids, libido, depression, bloating, food and sugar cravings, which I could just have this anyhow without even having a hormone issue, but we'll leave that aside, okay? Good deal? Those are the big ones. Another one that's kind of not on there that goes with it is hot flashes. And we'll explain that because that obviously has a lot to do with our usually imbalance of hormones, okay? And there are things that you can do for it to help. So I want to talk about this. So PCOS right now, right, there's the abbreviation, is the most common endocrine disorder now in women of the United States that are of reproductive age. So that's how a big deal it is. So essentially what happens with PCOS is the ovum, if you will, that has the egg is supposed to ovulate, in which it ejects the egg for possible fertilization. With PCOS, what happens is the egg never gets ejected, never gets released, and then it stays within that follicle of the ovary, and then it generates a cyst, okay? So that's not good, as you could imagine, if you're trying to get pregnant, all right? Endometriosis is another big one. That's 2 to 10% of American women between ages of 25 and 40. So do you guys know what endometriosis is? So essentially, during a normal cycle, we're supposed to shed the lining of our uterus, right? Menstruation is essentially shedding the skin out. And this doesn't happen completely. It never gets down to kind of like that bare bone layer. It keeps some of the vascularity, some of that tissue, and then it grows more tissue and it grows more tissue. So each time you have a cycle, if you're not completely able to get rid of the skin, you're having more and more, literally, tissue laying in your uterus. And then what happens is there's a little place in the anatomy, it's called the cul-de-sac of Davis, don't worry about it, but you can literally grow adhesions, these tissues outside of the uterus, where now people have attachments like in their abdominal wall, and it can go as high, I've seen it in some cases, as making this tissue attached to livers, which is really creepy, okay? So that's the idea that, of course, you're gonna have a hard time getting pregnant in that case. So I'm not here to just talk about pregnancy, but these are the biggies right now in the American culture. And then this one is essentially dysmenorrhea, so just a normal period, right? So 25 to 50% of women and 75% of adolescents have pain with menstruation, okay? And as much as 20% have severe dysmenorrhea or pain that prevents them from having like normal activities. So let me ask you this. You guys aren't doctors, but you're women. What's normal in our culture if you're an adolescent or if you're a young woman and you're having painful periods? How do they manage you? Usually you see your medical doctor, your OB, right? And what's the standard approach? You guys know? Heating pad. If they want to do something beyond that to keep you comfortable, do you have any shots? Birth control, right? So oral contraceptives. So that is where we're headed next, because that's that's used to address acne. I'm not a dermatologist, but right, our hormones change and it changes our skin too. So acne, oftentimes they'll be put on sometimes hormones first, and or trying to stabilize the discomfort affiliated with a period. They'll use hormones for that too. So 10.7 million American females are taking oral contraceptives. I want you to understand, I'm not poo-pooing oral contraceptives, but if you guys stop as women and you hear hormone replacement therapy, doesn't your mind just go to menopause, right? As women, you're just like, okay, they're not doing what they need to do, so now it's that time in my life where I'm talking to my doctor about Synthroid or Premarin or something like that. But this is a form of hormone replacement therapy. Birth control is, okay? So the most common reason U.S. women use the contraceptive is prevent pregnancy, which of course, that's what it's designed for. But this is a lot, 14% of pill users, or 1.5 million women, rely on them for non-contraceptive purposes. So I'm talking about like heavy bleeding, heavy cramping, acne, like something other than worrying about getting pregnant, okay? And then this also said there was a study they looked at, more than half, or 58% of a pill user relies on that method for purposes other than pregnancy again. Okay, so there's stuff going on with female hormones that we're only kind of scratching the surface on by just trying to arbitrarily put someone like on birth control. And I'm not saying it's wrong, I'm not saying it's bad. I took birth control for years, right? Like truly, especially when I got into college, TMI, but I didn't want to get pregnant. So I'm going to be real with you. I'm not saying the drug itself is bad, but it shouldn't be the only thing that's a go-to or that's considered when people are having issues with normal female kind of physiology, all right? So let's move over to menopause, if you will, towards the tail end, like the body's starting to kind of taper out of the usual cycle. So 6 million American women take an estrogen or estrogen plus progesterone therapy right now. In 2014, we filled 4.3 billion prescriptions in the US. It's a lot, right? And of that, 120 million of them were thyroid, or 121 were Levoxyl, but 131 million were just for thyroid therapy alone. We're not even talking now dysmenorrhea, PCOS. We're just talking like trying to get on with menopause and being done with it, okay? So out of all the thyroid medication prescribed, so really the Synthroid brand, if you will, was 91.6% of all those drugs. So it's a big deal. That's what I'm trying to show you with these stats, is that whether you're having, again, more towards the end of your female cycle issues or the beginning or somewhere in the middle, there's a lot that's happening in this country in terms of trying to figure out our hormones, right? And actually stabilizing women for where they are in their cycle in that part of their life, because it's going to change inevitably. It's supposed to, all right? So let's talk about this. So like the biggest challenge I think right now for a lot of women, men too, we're not here to talk about men, but is more so than ever. Well, let me ask you this. Where are hormones found? Are they found like in a mammal or in a body, or right? Or certain versions of them are in a living thing, correct? They should be made in a living organism, right? So now what's happening is this term that's called exogenous. It's outside of the body, that's all that means. So exogenous hormones. So things like estrogen or estrogen mimickers are often found in products, right? Other compounds, have you guys heard of BPA, bisphenol A, BPA? That's a big buzzword when you're trying to get like a plastic water bottle, you'll see now it says BPA free, or lining of a can says BPA free. So these are big time hormone disruptors. So what's happening, to bring you up to speed to what my initial point is, more so than ever now, women especially are having hormones dumped into their body from sources outside of their body. And that's kind of screwing things up, okay? So we have to acknowledge our exposure to things that, it's not to make you cuckoo crazy about it, but you should identify what possibly you might be doing as normal part of your routine that's dumping unnecessary amounts of hormones into your body before even considering having to take anything else, okay? So they're called EDCs, they're called endocrine disruptors. We're going to talk about what endocrine means. I've defined it for you moving forward, but they interfere with development and reproduction, okay? And they obviously have bigger implications, cancers, things like that, so it's scary. So they're looking at all that right now for cancer research too. So these chemicals, like I said, they can mimic hormones in your body. Like I said, female sex hormone predominantly is estrogen. It's not the only one, but that's the big one that we resonate with. And male hormones are androgens, okay, and our thyroid hormones. So again, something to know. They block normal hormone signals in your body, and they interfere with the way your hormones or receptors are made to control. So there's something called, and I don't know if you guys want to write it down, you don't have to. There's something with the cell. Do you guys know what a cell is, right? This is the smallest unit of your functional anatomy. So they have receptors on the outside. So it gets messages of what to do. So cells can be upregulated, meaning they'll grow more receptors to do a job. That's called upregulation. So it makes them more sensitive to what's floating around in the bloodstream. Or downregulated, meaning there's so much of it in the bloodstream, we don't need so much receptors, and they go away. Okay, so this process is constantly happening in the body. And I don't want to get too much into that, but just so you know that, we'll talk about it, stress and how we work as far as girls are concerned with that function of up and down regulation, okay? So, but right now, let's just look at the common sources of these EDCs, okay? So this one, I really have to hit home with you guys. Personal care products. This is a big one, okay? Shampoos, conditioners, your body lotion, your toothpaste, your deodorant. Think of, if you're menstruating, think of your period, right? It's a plastic applicator for a tampon that you're putting up in the body. And you think it's a piece of cotton that's absorbing, right, your flow, if you will, and or you put a panty liner. Again, is it BPA-free plastic? So this stuff is against your skin, and it takes only 2 to 5 seconds for anything that touches the skin to be absorbed into your lymphatics, all right? So, I mean, Lisa probably, she's like, preach, I know this. She worked in skincare. And here's the other thing that's really kind of unfortunate. In the United States, there is a federal law that allows upwards of 5% of a beauty product to contain estrogen without having to report it, okay? And the same can be said for a male product. Sometimes they put androgens in it, and anyhow. So literally, if you're like, Dr. A, I do my due diligence, I read the label at what I'm lathering all over my body or whatnot, and I know it's not in there, sometimes think twice. So here's my word of advice for you. The more simple the product, the better, okay? Truly. As far as, and I hate to say this, but as we age and we start to get wrinkly, a lot of these anti-aging creams, I hate to say it, like oil of Olay or Almaze or these over-the-counter ones are notoriously estrogen heavy, big time, okay? That and things that smell really good, like if you go to Bath and Body Shop and you have your, in the winter, I don't know, candy cane lotion or something like that. I mean, if they even disclose what's on the label, there's probably a lot of phthalates in it, okay? Triclosans is a different one that's more in the spray form, but this is a biggie. This is a biggie. So I encourage you that you really just keep it simple, like whatever beauty products you use, makeup, face wash, you should be making them trying to be organic if possible. They don't always have to be, but the cleaner the better, because this is stuff that stays on you all day and you use every day, sometimes multiple times a day. And you'd just be dumping it and dumping it and dumping it into the body you would never know twice, okay? So for me, like personally, I love Brommer's soap. It's a Castile soap. I've used that for years. I'm not plugging Brommer's, I'm just saying it's simple. It's literally, it's just liquid soap. It smells delicious. It doesn't have to be this like dirt smelling, nasty, natural product, okay? They've come a long way. As far as makeup is concerned, like I have a skincare line. I love it. I've used it for years. It is an organic one. I'm not here to plug that. I'm saying you should do your due diligence, your deodorants and things that you use all the time. You don't need the extra hormones more times than not, okay? There's usually an overabundance. So drinking water is another source. So drinking water usually, I mean, sometimes literally there can be arsenic in the water. So yeah, if you want, you can test your water. That's really up to you, okay? Just filter it. That stands a better chance. Canned foods, this is a big one, bisphenol A. So now, there's so much hype about bisphenol A, you actually can't use it in certain things in the country. So they've tried to find alternatives. So no verdict is out yet now if the different versions of bisphenol are safer than A was, right? So people start getting sick, people start having cancers and stuff like that, and they start attributing it to those really thin water bottles that get hot and they leach it into the water, or cans and things like that. It's a coating that's put on the inside of something that literally goes in your food product. Beer cans and stuff, like, you know, just think of it. Soda, if you're a soda drinker, that sits who knows how long, it gets hot and cold, and that stuff is just leaching in there. So it's not to make you crazy about it, but just that you have an awareness of like as a majority of what you're eating, drinking coming out of a can, right? And then are you using your beauty products at home, so on and so forth. I hate to say it, but conventional produce and meat right now, as you know, they're treated with herbicides and pesticides. So those are compounds enough. I'm not going to get into discussion of GMOs, but they change physiology. They make cells abnormal. They more higher incidences of having cancers, okay? Along with a lot of things. So just be mindful of it. If nothing else, put your attention here. High mercury fish. So I don't know if you guys eat a lot of swordfish or shark. Probably not. But anytime you have a farm-raised fish, you guys know what farm-raised is, right? They're fed like grain. And what are most grains? Most grains are corn-related, aka conventional produce, aka treated with both pesticide and herbicides. So that's in your fish. So anytime you get wild caught, the better, okay? And anytime you have a smaller fish, the less likely you are to worry about things like that. Of course, if you guys already know, if you have kids, when you're pregnant, like mercury is like a big thing there. Like, oh, don't eat swordfish. I mean, you can, just don't eat it all the time, okay? Kitchen products, this is a big one with our non-stick stuff. You guys love your non-stick skillets? I do. I mean, crying out loud. You make eggs and stuff. If you ever used a conventional pan, it's god awful. Like, there are things we need a non-stick pan for. But I have to tell you, most of them, they use these PFASs, and they're very, very highly carcinogenic. I will tell you, cast iron is good to cook with, just normal stainless steel. But legit, if you want a good non-stick pan, I would advise you to go to Williams-Sonoma. They make something called a green pan. And it is amazing. This thing, I have a whole set of them. I'm not here to endorse them. I'm saying I love it because it doesn't have that coating on it that gets scraped up as you use that pan over and over again and eventually makes its way into your meal. Gross. And it takes really high temperatures. Things amazing. They're amazing. I'm so in love. Okay. Cleaning products, NPEs. These are all chemical compounds. But anytime you can kind of, I don't want to say green up, but there's a real push for that now in this society. But I hate to say it, we have laws in the U.S. That are not prevalent in very many other countries of what's allowed to be in what. So don't become over worried about it, but you should have an awareness. It's very easy to switch out cleaning products to healthier choices, and they still do a good job cleaning, right? Like I use Clorox for my toilets. I'm not gonna put lavender oil in and smush it around, and for me, like, no, that's not happening for a toilet. But for other parts of my home, there's very many other options that you can use to help, okay?